The Differentiation of Warm Diseases, written by the Qing Dynasty physician Wu Tang. Chapter 2, Upper Burner Section, Sections 35 to 40. Summer heat section. Although summer heat and hidden summer heat are referred to differently, the essence of the diseases is the same, and the treatment methods need to reference each other before and after. Therefore, a separate section is not established in the middle and lower burner sections. 35. On hot days combined with dampness, leaning towards the condition of excessive heat is referred to as summer warmth. This situation is commonly associated with the Han-Tai-Yin syndrome, characterized by symptoms of coldness and dampness. When treating summer warmth, it is advisable to employ cooling methods. Conversely, leaning towards a heavy presence of dampness is termed damp warmth. This condition is often associated with the Fu-Tai-Yin syndrome, manifesting as heavy dampness and coldness. When treating damp warmth, it is appropriate to utilize warming and heating methods. If dampness and heat are equally balanced, then distinct treatment approaches need to be employed without mixing them. This passage continues from the previous text, discussing the treatment methods for summer heat and warmth. It is one of the most subtle aspects of ancient medical practices and differs from the earlier discussion about warm diseases. Therefore, it is not repeated here. It is worth noting that the Neijing explicitly states that diseases manifest as warmth before the summer solstice and as heat after the summer solstice. This underscores that although warmth and heat are different, their origin is the same. We cannot focus solely on warmth while neglecting heat, nor can we only discuss heat and overlook dampness. Although there have been instances of confusion among renowned physicians throughout history, Yi's method stands out as the most refined. Unfortunately, later generations could not fully grasp its essence. However, elements of his treatment methods are reflected in case studies. While the sections may not be entirely definitive, a superficial reader may feel puzzled. This is understandable as later scholars lacked clear guidance, making it difficult to master this medical art. Therefore, this thesis extracts its general content and loosely outlines a framework for scholars to follow. However, the subtleties within are numerous and cannot be exhaustively listed. Scholars still need to refer to various interpretations of Yi's case studies by different schools before delving into a deeper study. Additionally, according to Zhong Jie's statement, heat stroke occurs under static conditions, while overheating occurs during physical activity. Heat stroke belongs to the yin category, as the term heat is derived from the sun, which is classified as yin. Heat stroke involves fire, which is not yin. Heat stroke also contains dampness, but this is of a damp nature and not pure yin evil. Overheating, on the other hand, belongs to the yang category. This statement can indeed be perplexing, as it appears to blur the distinction between heat and warmth. Zhong Jie further states, heat stroke belongs to the yin category because the term heat originates from the sun, which is yin in nature. Heat stroke contains the element of fire, which is not yin evil. There is also dampness in heat stroke, but it is of a damp nature, not pure yin evil. In contrast, overheating belongs to the yang category. This explanation makes sense because it is essential to understand that heat can also be accompanied by impurities and dampness, which are yin in nature. Thus, overheating is not purely devoid of yin elements. In fact, what Zhong Jie describes as heat stroke corresponds to the damp warmth discussed later in this thesis, while overheating aligns with the warmth and heat discussed earlier in the text. Zhong Jingyu further distinguished between yin heat and yang heat. Yin heat refers to a condition where there is an excess of dampness during hot weather, displaying symptoms characteristic of the Fu-Tai-Yin syndrome. In contrast, yang heat refers to a situation with an excess of heat during hot weather, manifesting surface symptoms of the Han-Tai-Yin syndrome. Scholars who fail to grasp the overall concept may make errors in selecting acupuncture points. Many renowned physicians since the Song and Yuan dynasties often held a self-centered approach and did not strive for methods in harmony with the natural order. This has led to the obscurity of medical practices and the inadvertent misleading of others, which is regrettable. Dr. Wang's explanations clearly differentiate between dampness and heat, affecting the hands and feet, providing scholars with a lucid method to minimize errors in treatment. Additionally, Zhong Jie's reference to those in motion pertains to individuals who become ill due to strenuous labor and exposure to hot weather. Those at rest refers to those in comfortable circumstances who seek shelter in cool buildings, but may still suffer from heat stroke or be troubled by dampness. However, it's essential not to rigidly adhere to this classification, as sometimes those in motion can also be affected by humid weather, and those at rest may still be influenced by hot weather. For those at rest, there is a situation where excessive cooling and consumption of cold beverages can induce internal coldness. In such cases, treatment methods like Guiji Da Shun Tang or Li Zhong Sai Ni Tang may be employed. This scenario corresponds to summer cold damage and requires a case-by-case analysis. As for Zhong Jingyue's 6-Qi treatment method, it has not been thoroughly investigated, and a detailed discussion is not warranted at this time. 36. During the long and scorching summer weather, illnesses that occur after the summer season are termed hidden summer heat or retained summer heat. Cases that manifest before the onset of frost are relatively infrequent and milder, but once frost arrives, the condition becomes more severe. Cases occurring in winter are particularly grave. Years associated with the Chinese zodiac signs of Zi, rat, Wu, horse, Chou, ox, and Wei, sheep, more prone to hidden summer heat. During the extended summer period, extreme heat may not affect robust individuals significantly. However, those with weakened constitution may experience momentary dizziness, lasting for some, and gradually recovering. In some cases, symptoms may appear immediately and intensify gradually. People who do not immediately fall ill but harbor pathogenic factors lurking within their bones or muscles typically suffer from Qi deficiency. Qi deficiency prevents the prompt expulsion of pathogenic heat, requiring the arrival of cool autumn weather when the metal Qi, a physiological energy, can engage in a battle with the pathogenic heat and expel it from the body, leading to the outbreak of hidden summer heat. If the Qi deficiency is severe, even the presence of metal Qi may not be enough to expel the pathogenic heat. In such cases, it may be necessary to wait until late autumn or early winter when the slight coldness forces the expulsion of the pathogenic heat. Consequently, hidden summer heat in these circumstances can be particularly severe. Years associated with the Chinese zodiac signs of Zi, Wu, Chou, and Wei are more prone to hidden summer heat because Zi and Wu represent fire, and hidden summer heat is inherently related to fire. Chou and Wei represent damp earth, and the presence of dampness makes the expulsion of pathogenic heat more challenging. 37. If one experiences symptoms such as a slight headache, mild aversion to cold, flushed facial complexion, irritability, and thirst, with a white-coated tongue, a rapid and moist pulse, it could potentially be a condition caused by Tai Yin hidden summer heat, even during the winter months. If the headache is accompanied by pronounced aversion to cold, it might resemble a condition similar to Qing disease, a type of febrile illness. However, if redness of the face and thirst are also present, then it is not Qing. Although this presentation may appear somewhat like the Yang Ming syndrome of Qing, a rapid and moist pulse confirms that it is not Qing. Qing typically presents with a tense pulse, whereas in this case, a rapid and moist pulse indicates signs of weakness. Weakness implies moisture, and moisture may signal the presence of internal deficiency heat. Internal deficiency heat represents internal warmth within the body, while moisture signifies water. Heat is inherently hot and water is inherently cold. They exhibit different characteristics and qualities. Therefore, hidden summer heat and Qing should not be conflated. Consequently, even during the winter months, hidden summer heat can manifest, just as it does during the autumn season. Hidden summer heat and Qing are akin to the differences between men and women. One is externally real and internally deficient, while the other is externally deficient and internally real, and they should not be confused. 38. In cases of Tai Yin hidden summer heat, characterized by a white-coated tongue, thirst without sweating, and stagnant pathogenic factors within the body, one can employ Yin Qiao San, honeysuckle and forsythia powder. Additionally, incorporating burdock root, astragalus root, almonds, and talcum powder in the treatment regimen is recommended. This condition suggests that the pathogenic factors are lingering within the body, manifesting substantial symptoms on the surface. 39. In instances of Tai Yin hidden summer heat with a red tongue, extreme thirst without sweating, and pathogenic factors residing within the bloodstream, Yin Qiao San can also be employed. To enhance the treatment, one may include Rihania root, mountain bark, red peony, and Ophuopagan root. This condition indicates that the pathogenic factors are stagnating within the blood, with substantial surface manifestations. 40. In cases of Tai Yin hidden summer heat, characterized by a white-coated tongue, thirst accompanied by sweating, or excessive sweating, treatment can involve the use of Yin Qiao San, honeysuckle and forsythia powder. In this case, omit burdock seeds, astragalus root, and mustard seed from the formula, and instead include almonds, gypsum, and skullcap root. If the pulse is large and forceful, thirst is severe, and sweating is profuse, the white tiger decoction may still be employed. If the pulse is weak and large, thirst persists, the ginseng white tiger decoction can be used. This situation suggests that pathogenic factors are lingering within the qi aspect, with concurrent surface manifestations of weakness. To be continued.